Good evening, everyone, or good night by this time. Can you listen to me?
Yes, teacher, good night.
Yes, teacher, good night.
Okay. Can you watch my screen?
Yes.
Okay, perfect. Mm, okay. Today we're gonna start with this part that is another topic, and I will ask, please. I don't know who is it. Mm, Andres, can you help me here reading this part? Okay, Carlita, don't worry. Okay, Jorge, can you help me out with this part, please?
Sure, good evening. Okay, some types of skin lesion. Medical term, macule, common word, spot, features not raised above the surface of the skin. Medical term, papule, common word, spot, raised above the surface of the skin. Medical term, nodule, common word, lump, features a large papule. Medical term, vesicle, common word, small blister, features filled with fluid. Bulla, common word, blister, features a large vesicle. Pustule, features filled with pus. Crust, common word, scab, features dried blood on the surface of the skin. Medical term scales, common word scales, a thin layer of epidermis separated from the skin. Medical term cicatrix, plural cicatrices, common word scar, features a mark on the skin after healing. Medical term nevus, common word birthmark, features a colored skin lesion present at birth. Medical term fleshy nevus, common word mole, features a raised brown nevus. Medical term verruca, common word wart, features an adult produced by HPV. Medical term furuncle, common word boil, features a large pustule or skin abscess. Note, the liquid, often yellow, formed as a result of infection is pus. If a lesion is pustular, it is filled with pus.
Okay, thank you so much. And I don't know if you have any questions here. Or is it clear? For example, do you understand fleshy nevus? Who can tell me what is it? Nobody?
I think that fleshy nevus is like a large pot that has some some raised. It has a like his
Questions?
deep. Is more. Is raised. It's not a plain as the skin, but it's raised and is you can touch that difference.
Okay, it's palpable, the difference. Okay, thank you, Mateo. Anyone else? Or maybe you have another question? So is it clear here? Can we continue?
Yes, teacher.
Yes, teacher.
Thank you. Alejandra Macías, can you help me here, please?
Sure. Ratios. A single skin lesion can be regular or irregular in shape. When there are many multiple lesions, especially macular or papules, the result is a rash or a spot in common language. For example, the rash of an infectious disease such as rubella. A rash is said to erupt or break out. The following features or skin lesions are usually noted: location, size, shape, color, type. For a rash, note also distribution, widespread, or many parts of body or located on the part only. Grouping is scattered, more or less evenly spread out, or in clusters, small groups.
Okay, thank you. So let's do it again. A single skin lesion can be regular or irregular in shape. When there are many or multiple lesions, especially macular or papules, the result is a rash or a spot in common language. For example, the rash of an infectious disease, such as rubella, a rash is said to erupt or break out. The following features of a skin lesion are usually noted: location, size, shape, color, type. For a rash, note also distribution with the spread on many parts of the body, or if it's localized on one part only. Or maybe if it's grouping, scattered, more or less evenly spread out, or in clusters that are small groups. Okay, do you have any question here?
Excuse me, Miss.
Yes.
What does scattered means? Scattered?
Scattered. Grouping, right? Scattered. More or less evenly spread out, like there are many of them.
Yeah. Okay, thank you.
Okay. Any other question here? No questions?
No.
Yeah. Here, Mateo, can you help me reading this part, please?
Okay. Injuries to the skin. Here's an extract from a medical website. Mechanical injuries to the skin are divided into those caused by a blunt force, such as a punch from a fist, and those caused by a sharp force, such as a knife. Injuries from blunt forces. An abrasion, also called graze or scratch, is a superficial in the surface injury involving only the epidermis, which has been removed by friction. The scratch is linear, as in fingernail scratches, whereas a graze involves a wider area and in abrasions caused by dragging part of the body over a rough surface. A contusion, also called a bruise, is an injury that occurs when blood vessels in the skin are damaged. A laceration, also called a tear, is a wound involving both of the dermis and the epidermis. It is usually distinguished from penetrating or incised wounds by its irregular edges and relative lack of bleeding. Injuries from sharp forces. An incised wound, also called a cut, is a break in the skin where the length of the wound on the surface is greater than the depth of the wound. For example, a wound caused by a razor blade. The depth of the penetrating wound is greater than the superficial length of the wound. For example, a stab wound caused by a knife.
Okay, thank you so much. Is there any question here? For example, what is a blunt force? Do you understand the meaning? Nobody?
I think that is a force that impacts someone, but with no, well, I don't know how to say. There is not a sharp object that is impacting someone, so it doesn't causes I don't know, a laceration at first, but it can cause a contusion.
Okay, that's a good description. Thank you, Mateo. And can you tell me in Spanish what it is?
Es like una fuerza de empuje o como
Fuerza contundente.
eso.
Okay, thank you. Any other word that you don't understand?
Grace.
Graze or scratch, right?
Ah, okay.
Okay. That is when maybe if you have a cat, for example, he will scratch or graze your pillow with its nails. Do you understand now?
Yeah, thank you.
Okay, perfect. Okay. Do you think we can continue now?
Yes, teacher.
Thank you. Okay, we have here a case report. Like an example. Melanie, can you read this part, please?
Yes, Miss. Case report, case 2. A 9-year-old boy presents to the accident and emergency department after he stumbled and fell while running in a wood. He had received a blow to the head from a rock and had been scratched by bashes. On examination, a vertical laceration 1 cm long was noted on the bridge of his nose, just right in the midline. There were a number of superficial scratches on the right side of his forehead. His right upper lip was middle contused.
Okay, thank you so much. Do you have any questions here? Do you understand the word stumble?
Tropezar, teacher, stumble.
Yes. Thank you, Rina. Thank you so much. Okay, is there any other question here?
No, teacher, all is clear.
Thank you. Perfect. This word blow to the head from a rock. Blow, this case. Do you understand it? Okay, I think now. It's like you've been hit or punched in this case. Okay? Okay. Rina, can you help me here, please?
Yes, teacher. Source. The word sore is a popular term for many different types of skin lesion, especially infected lesions. A pressure sore is a skin ulcer caused by pressure, for example, the pressure of lying in bed for long periods, also known as a bed sore or decubitus ulcer. A cold is a lesion caused by herpes simplex. Note, the adjective sore means painful. For example, a sore throat.
Okay, thank you. The word sore is a popular term for many different types of skin lesions, especially infected lesions. A pressure sore is a skin ulcer caused by pressure. For example, the pressure of lying in bed for long periods, also known as a bed sore or the decubitus ulcer. A cold is a lesion caused by herpes simplex. And note, the adjective sore means painful. For example, a sore throat. I think this is pretty much clear, but I don't know if you have any questions here for vocabulary. No questions here?
No, teacher, all is clear. All is clear.
Thank you, Irina. Okay. Valeria, can you read this part with Jethro?
That dialogue.
Conversation. The conversation.
Okay. The urinary system. Doctor, are you having any trouble with your waterworks? Mr. Jones, well, I do seem to have to go to the toilet more often than I used to.
Vale,
How
vale.
often?
Wait,
Yes.
please. You're gonna be the doctor and Jethro is
Ah.
gonna be Mr. Jones. I'm so sorry.
Okay. I'm sorry. I didn't
Wasn't
understand.
clear. No
Okay.
worries.
We'll start again.
Jethro, are you here?
Yeah, yes, teacher.
Okay. Okay. Go ahead.
Okay. Are you having any trouble with your waterworks?
Well, I do seem to have to go to the toilet more often than I used to.
How often is that?
It depends, but sometimes it's every hour or even more often.
What about at night? Do you have to get up at night?
Yes, nearly always 2 or 3 times.
Do you get any burning or pain when you pass water?
No, not usually.
Do you have any trouble getting started?
No,
Is the stream normal? I mean, is there still a good strong flow?
perhaps not quite so good as it used to be.
Do you ever lose control of your bladder? Any leaking or dribbling?
Well, perhaps a little dribbling from time to time.
Have you ever passed blood in the urine?
No, never.
Okay. Thank you so much. As you can see, we're talking about the urinary system. And urine is formed in the kidneys and stored in the bladder until it is passed or voided. Okay, patients may say, I have some pain when I pass water or when I pee. And doctors may say, are you having any trouble with your waterworks? Okay, do you have any other way to ask some questions to your patients? Nobody? Come on, guys. I've heard you a lot of times talking about these questions.
We can ask about the time of patient go to the toilet.
Yes. Okay, Andres, thank you. Any other one? Nobody? Okay. Oh, continue.
I don't know, like, do you feel like empty your bladder when you urinate?
Yes, it's another way to ask your patient. Okay, thank you, Vale. Do you understand the words leaking and dribbling?
Yes.
Can you explain it, Rina, but in English?
Like to fall something slowly or to
Yeah.
drops.
Yes,
Uh,
that is leaking. In dribbling. Well, both seems to be kind of similar, but they have different meanings in Spanish. Now, can you tell me in Spanish what it is?
leaking sería como, ahí se me ha ido la palabra como de derramando, no, cayendo, no sé, la verdad, cayendo.
Como goteo.
Ajá, goteo.
¿Sí? Como fuga. Okay. Okay, but you can use both. Thank you, Rini. Any other question here? Okay, I think there are no questions. Who's gonna help me here? Andres, can you help me here, please?
Yes, teacher. Common urinary symptoms and their definition. Frequency, frequent passing of urine, dysuria, burning or scalding pain in the urethra when passing urine, nocturia, urination at night, urgency, urgent needs to pass urine, hesitancy, difficulty starting to pass urine, urinary incontinence, involuntary passing of urine, and hematuria, macroscopic blood in the urine.
Okay, thank you. Well, this is so much clear. Frequency, a frequent passing of urine. Dysuria, burning or scalding pain in the urethra when passing urine. Nocturia, urination at night. Urgency, urgency need to pass urine. Hesitancy, difficulty starting to pass urine. Urinary incontinence, involuntary passing of urine. Hematuria, macroscopic blood in the urine. Okay, do you have any questions here?
Yes, teacher. Dysuria is, for example, burning is in Spanish is like ardor.
Yes. Scalding. Do you understand the meaning of scalding?
Yes.
Okay.
Thank you.
No problem. Anyone has another question? Okay. Let's go with Claudia. Can you help me here, Claudia, please? I think she's not here.
Yes, teacher, I'm here.
Okay. Help me
Okay.
out.
Urinalysis. Okay, I will. Urinalysis is the analysis of urine. Simple screening tests of the urine are carried out with reagent strips, for example, clinicistics, for the detection of glucose. More detailed tests are carried out in a laboratory on a specimen of urine. Typical specimens are a midstream specimen, MSU, and a catheter specimen, CSU. Microscopic examination may reveal the presence of red blood cells, pus cells, or casts. Casts are solid bodies formed by proteins or cells. Plus, signs are used in case notes to indicate abnormal findings. A small amount, positive, is described as a trace. For a large amount, the words gross or marked can be used, for example, gross cemetery. When there is nothing, the word nil is common. There was no sugar, a trace of protein, and gross cemetery.
Okay, thank you so much. Here, do you have any question? For example, these clinicistics. Do you know this kind of test? How is it, how it works? Well, as you can see here on this image, you have a strip, right? And when you put deep into the urine, it can mark positive or negative. And it will be indicated by the color of this strip. Okay. I don't know what is the name in Spanish. Someone who can help me here, please.
I think that clinicistics is like the brand of the screening test, right?
Yes.
In Spanish, it would be, I don't know the brand, but it's las tiras reactivas.
Yes, that's the name. Thank you. Thank you, Mateo. Okay. Okay. Oh, sorry. Okay, as you can see, this subject is a little short, so we can make some questions if you want. For example, these typical specimens are midstream specimen. It's a test when you can observe the microorganisms. I think it's clear, right?
Yes, teacher.
Yes.
Perfect. Now, can we talk about our schedules for practice, for our practices?
Yes, teacher.
I will write down the names of the people who want to be since 7, but we have to switch, okay, with the other people who were like at 10 or 10:30. Can we do that?
Yes, teacher, please.
Okay. Claudia, I will let you choose what time is better for
Okay.
you.
7 p.m., please.
8:30. Okay,
7 p.m.
okay,
Thank you.
okay, thank you. 7:15. Who else was late?
Me?
Vale?
Yes.
Okay, Vale. You were at 9:15, right?
Wait, 9 or 7?
No, 7:15. You were
Okay.
at 9:15 the first time.
I don't know. This is my first time.
Okay. Your first time
Class.
in this module.
Yeah.
Okay. Okay. 7:30.
I'll take that time if no one.
Okay, Mateo. Well, 7:45.
Miss, please. Melanie?
Melanie. Yeah. Melanie.
Yes, miss. Thank you.
No problem. Okay. I don't know. Okay. 8.
It's okay for me, miss.
Okay, got it. 8:15.
Hey, teacher, please.
Tetro. 8:30.
Could I pick it, please?
Yes, Jorge.
Okay. Thank you.
8:45.
Me, teacher.
Rina.
Yes. Thank you.
Okay. You. 9.
Me, teacher, please.
Yes. 9:15.
Me, teacher.
Andres. Okay. 9:30. Weimar. Jocelyn. What about you?
Me, teacher.
Okay, 9:30. 9:45. Jocelyn.
Okay, teacher.
Who's missing? Carla Calle. It's okay for you at 10. Uh-oh, she was driving at home. Okay. While we expect her answer, please, I will ask you to fill my questionnaire. Missing. Anyone else? Sergio. Oh. Two more. Anyone? Everybody can see my questionnaire.
Yes, I already submitted.
Okay, thank you. Aymar, you already did it?
Yes, teacher.
Okay, Jocelyn.
Yes, teacher.
Thank you. Okay, well, and maybe Carla that just couldn't. Okay, just a peek and I will let you go. And see you tomorrow, okay? Okay, thank you so much. Then who's missing? Thank you, Carla. Okay, now. One more, please. Okay, thank you so much, guys. See you tomorrow. I will put your schedules on in the group, okay? So you can remember. Goodbye, take care. Thank you so
Bye,
much.
teacher. Bye,
Bye,
guys.
teacher. Bye,
Thank you,
guys.
teacher. Bye.
Bye.
Bye-bye.